I'm Jeff Williams, Mayor of the American Dream City, Arlington, Texas. We realize that healthcare realities are changing. We are seeing a growing demand for EMS services, which is a financial stressor for many cities across the country. We also realize the possibility of a hospital readmission increases significantly when a high-risk patient is discharged and returns home to an unstructured care support environment. To address these challenges, a one-year study known as the Community Paramedic Program was implemented by the City of Arlington Fire Department. The program is a public-private collaborative effort between the city, our ambulance contractor, American Medical Response, our local hospitals, and our social service agencies. The program goal is to stabilize and improve the health of certain types of high-risk patients who may immediately return to the hospital through the 911 system because of unanticipated medical or social service needs. This is where the Community Paramedic Program makes a difference.
This program was created with several goals in mind, including bridging the gap between hospital discharge and returning to a productive lifestyle, decreasing 911 responses, and improving the overall health and wellness of the Arlington community. To meet these goals, our community paramedics go through an in-depth physician-taught training program that includes didactic and clinical rotations. The community paramedics have developed strong working relationships with medical practitioners in the community. These relationships allow them to work directly with their patients' physicians to resolve issues found during home visits. This means that the patients get to stay in their own homes, yet receive a high level of care. During these home visits, the community paramedics bring advanced technology along with their normal medical supplies. This includes upgraded cardiac monitors and portable lab equipment that allows them to do blood work in the home with rapid test results. The community paramedics are also able to help citizens access helpful programs and services through many organizations in the city of Arlington. During the first 90 days of the program, there were significant measurable outcomes. 911 calls were reduced by 158 in comparison to the previous 90 days in a select group of citizens due to interaction with paramedics in the Community Paramedic Program. These same group of citizens had a 60% reduction in ER visits and an 85% reduction in hospitalizations in the same time frames. These reductions allow the hospital to see a $361,000 cost avoidance that, due to the Affordable Care Act, would not have been paid by Medicare or Medicaid and could potentially result in penalties for the hospital later on. In summary, this program has a definite impact on improving patient outcomes and quality of life. It has had a proven decrease on the demand of the 911 system and has proven to have a significant impact on cost avoidance for the hospital, all of which help improve the life and well-being of our citizens.
Hi, I'm Blake Kratz, President at Texas Health Arlington Memorial Hospital. Well, I think this program has been great for the Arlington community because it's been a public-private partnership, and we've been able to really affect people's lives in a positive way. Patients that have come into our emergency room that used us almost as primary care, we're now seeing that their visits back to our emergency room are down 75% because they're getting the care they need in their home. The paramedics do a great job not only taking care of their medical needs, but the social needs and the needs within the home that we can't do. And so I think that's where the real value of this program has come into place, that they can partner with us in ways that we couldn't help the patient.
It's more than just help that's available through other community programs that have stepped in to help, but there is more of a personal connection with this program that has really, it's just been the most amazing, the most tremendous help that I could have ever imagined. And I am really, really grateful for everything that they've done. And I know that my mom is in good hands. And I just can't say enough good things about the Arlington Fire Department. I'm truly grateful. There have been other times where there were issues with my mother's medications, and they were able to come over and help fix it. And I knew that it would be corrected in the right way. I didn't have to rely on somebody else who wasn't trained to interpret any doctor's instructions. They are trained, and that it's an extra level. It's a much extra needed level of professionalism that's there. And again, great, wonderful peace of mind. And I know that she's safe.
The Community Paramedic Program has produced clear and measurable improvements for our community through fewer returns to local hospital ERs, reduced hospital readmissions, reduced use of the 911 system, lowering of healthcare costs, and improving overall patient and community health. In Arlington, Texas, we work closely with community partners to provide state-of-the-art services at contained cost while improving the quality of life for our citizens.